out and ran focus groups, asked people what they thought, went to a whole lot of different groups. We pulled all that together into a draft document that was circulated earlier this year, and after the feedback we've come up with this final document.
Yes, I mean, it went out to nearly 300 organisations and individuals for consultation, and we got about 80 substantive comments on that, and they've all been taken into account. And they range right across services, from primary care, from community, from patient organisations to specialist services. So we've tried to cover off as much of the spectrum as possible. Really important thing about diabetes care is it has to be collaborative. It has to be collaborative with the person with diabetes leading it, and it has to encompass every part of the health service that they may come into contact with, rather than being totally separated.
Stake in the ground about how important diabetes is, and how we have to get control of diabetes in New Zealand to ensure that people do live well, or we will, as the Minister said, have people that have shorter lives with lower quality. So it's really important that we get traction with diabetes. Well, it's building on all the work that's happened before, but it is actually a coherent picture of where we need to go, and it's got measures behind it as well, so that we'll know that we're getting there.
The really important thing is, if you're going to win on diabetes, then you prevent as many people as possible getting diabetes in the first place. And that's partly here and partly will be in the obesity work. If people have got diabetes, then the earlier you detect any problems with the diabetes, then the sooner you can start treatment. And the real problem with diabetes complications is that they're silent, they don't hurt, and unless you have regular checks, a bit like the car and a warrant of fitness, you don't effectively treat them and deal with them. So the whole idea is to move self-care to a higher importance, but also to make sure that the system delivers, as it were, warrants of fitness, but not just warrants of fitness that lead to improved care and reducing the subsequent risk of the serious complications.
This represents feedback from a lot of the health system, and all the feedback's very consistent about what needs to happen.
The real difference is that this minister and the last minister have both seen this as a broader issue than just single aspects of diabetes care. And previously, a lot of the initiatives in diabetes have been focused on one or two priorities, and that doesn't really meet the needs of care for people with diabetes. And that's why here you've got multiple parallel priorities that actually make a coherent whole, rather than just concentrating, say, on kidney disease, or concentrating on self-management, or concentrating on prevention. And I think the strength here is that all those items come together, and the work plans that we'll be developing will follow each of those simultaneously, not one after the other, not one instead of another, but to try and create a whole of system approach rather than just a focused one.
This is a piece of work that recognises the priority that's being given to diabetes.